Well, this is good. We finally get to put a face to the name. We've talked about Dr. Matt Bay so many times, and he's with us in the studio.
And you know,
now.
he doesn't seem like a Matt, does he?
Yeah. He seems
Some
like a
people call
doctor.
me Matthew, but that's when I'm in trouble. It's my mom.
You kind of look like Opie or something.
Well, Dr. Bates, thanks for joining us.
Yeah,
today. This
happy
is
to be
nice
here.
Finally
I am
get the behind the scenes
knocking
here.
down your credentials.
Yeah,
No, not at all.
And thank you for sponsoring what we do here.
Sure.
We really do appreciate that because it's difficult enough to do it for the little bit of money we do it for.
Yeah. Well, you guys are fans of St. Louis products, fans of St. Louis
totally.
innovators and entrepreneurs, and I grew up here. So this is my home.
Yes, we have a St. Louis room. That's where it all started.
That I didn't know.
in our home we do,
he
yeah.
put like all this memorabilia and stuff
Oh,
from St.
okay.
Louis, and now look.
I mean, I go to concerts and I see Beatle Bob, and then I look on your website, and he's on your
Exactly.
There he
website.
is.
Does he still go to a concert every day?
He has not missed one in something like 10 years.
Yeah, he's in the Guinness
Every
Book of World
single day.
Records. Yeah. A customer was just asking about him at the Fountain on Locust, and I was talking to them about how he dances. He's got this certain bob. and
Yeah, oh, I
everything.
could
Now,
do it.
do you look at that? I mean, do you look at people like that and say, okay, he's limping. He might need some non-surgical procedures.
Oh yeah, sure. I mean, well, we got to get the groove back in his dance if he's hurting.
Yeah.
But when I see him dance, he looks good.
When you see people, do you see mostly sports people, sports injuries?
You know, thanks for asking. It's a diverse population, so I see a lot of active injuries, be it in youth, young adult, or adult, and the weekend warriors. But I see a lot of chronic pain in joint pain in elderly.
Yeah,
I mean,
well,
so
you know what?
osteoarthritic patients are usually older patients.
Well, I have some arthritic
Joy, you're an
issues.
older patient.
Yes. Well, no.
He looked at you
I'm in
when he
denial.
said that.
Yes,
he looked
exactly.
right at you when he said
Only because I haven't seen you yet.
But I
I'm in
want
line.
to get this out in the open because this is, he's not just a doctor because you can just flip it off because there's another doctor. What he's doing is something really different, and you might have heard about this stem cell regenerative stuff, and it's related to prolotherapy also, which people don't know about. So, if you would let me just keep talking.
Yeah.
Yeah, we don't really need you anymore. I think she's got it down.
I'll just go eat ice cream.
I'll tell you that I found out about prolotherapy a while back, and not everybody does it. It's been done over in Europe, I guess.
Europe kind of pioneered.
Yeah, for a long time. And here you have to search the country and hope there's somebody within driving distance. And there actually was somebody that I went to, and it worked for me. And then this came out, which I didn't know about. And this is even prolotherapy is, you better explain what it is.
Well,
'cause
yeah, I can take you through the kind of recipe menu of treatments that we do. So when you're talking about osteoarthritic pain, let's use that for an example, because we can do tendon injuries, rotator cuff pain, shoulder pain, knee pain. So if they have an osteoarthritic knee pain, they have thin cartilage related to wear and tear or an injury or genetics as the basis of their pain. So we can take the body's regenerative healing potential, package it, concentrate it, make it bigger and better, and then put it right into the problem using an ultrasound-guided needle injection.
Okay.
That's amazing.
But what is that really? You're taking like actual fat and bone
So that
marrow?
would be the higher order thing. Let's start
Yeah,
with prolotherapy.
okay,
So
okay.
prolotherapy is the use of sugar water,
Yes,
actually.
yes.
And sugar water causes an osmotic change where you inject it, and that means like the concentration of particles in the liquid is different. That causes the cells in the area to change and start the inflammatory process. The inflammatory process heals you.
If I might just interrupt and talk.
Please do.
Because I want to talk the same time you're talking.
So shut up.
What I
Basically
tell
what she's saying is
people, because I go around telling people about it because they don't know what prolotherapy is. And you tell me if this is okay, because this is what I've been saying.
Sure.
When you have an injury in life, like you sprain your ankle, and your ankle will puff up and get hot and swollen and makes this like little cushiony pillow. And our thought is, oh my God, let's
I can't wait to
reduce
see the graphics for this.
reduce the swelling. That's like our mindset. Well, the body has a reason to do that. It's protecting the injury until it has time to heal, but we're in such a hurry. We want to get everything done now. So we reduce that thing and it heals, but sometimes doesn't heal right. So prolotherapy puts an irritation back in there, which causes it to re-heal again properly. Is that
There's good inflammation and bad inflammation.
Yeah.
So we think when there's a big injury, you tip the scales over into more of a painful inflammation that isn't really helping as much. We can bring that down at the same time through the use of a PRP, a prolotherapy, or a stem cell. And I'll talk about all that stuff. But the prolotherapy, really, it just starts that healthy inflammatory response. I always use the example, if you get a cut on your hand, it's going to get red and raised and bleed, and then you'll get a scab, and it's a little local swelling. And then 6 weeks later, you don't even see anything. That was inflammation at work.
Yes.
Rebuilding your skin.
Yes.
I'm seeing a side of Joy I've never seen before, and we've been married 40 years. This is amazing.
What?
What you know about this is amazing.
She has done her homework.
Yeah, she did her homework. Yeah, which is...
He's watching TV and drinking a beer and multitasking.
Hey,
okay,
but I don't have sore knees either.
that's multitasking.
However, I find it interesting that Tony Roldan here at Honest TL is one of your patients.
Yes.
As is Kathy Kaiser.
Oh yeah,
Both
from
of them,
the movie.
well before he
Club.
started sponsoring Honest TL.
Yeah, yeah.
And Kathy sent me video footage of her procedure and said, "Here, you can show this." And I looked at it. There's no way I'm going to show this.
Well,
Maybe we
Are
can
we
pick and
seeing it?
choose and make it okay.
You don't want to see it.
well then to say what the stem cell therapy, is that what you call it?
Yeah. So stem cells are a step beyond prolotherapy. So prolotherapy's been around for 30 or 40 years.
Yeah.
And we still do that occasionally, but we have found that the use of your platelets, called platelet-rich plasma, or PRP, and then the use of stem cells from either your fat or your bone marrow
Instead
is
of
more
the sugar
effective.
water.
Yep,
Yeah,
is
so-
more effective.
And is it correct to say that could actually regrow missing cartilage?
Absolutely. No,
Okay.
it is MRI proven. This is not witchcraft. This stuff works.
That's fantastic, because I don't think there's any other way to grow.
No, there is not. You can do a transplant. You can go see a surgeon and
Yeah.
do a transplant. And those are all surgical methods with big downtimes, and that's the negative.
Yes.
You can go to, for those who are following this, bluetailmedicalgroup.com to learn a lot more about it. I think we piqued their interest. If we go much longer, they're going to say, "Nah, I'm not going to do that." You're at the Walker Medical Building.
We are until about June. Then we're moving into a new clinic we're building out in the Chesterfield Valley, right at Daniel Boone Crossing. There's that Taubman Outlets.
That's farther away?
It's just a bit. No, it's just one more sip
aren't
of
you-
your soda.
You maybe, but everyone
You know,
out there.
some doctors have 2 locations that
Oh,
they divide
boy.
their time.
Oh, boy. This is dangerous. I should put one right next door to you.
Yes.
No, so
We have some space in the lobby.
it's not too far. It's right at Daniel Boone Crossing, right where all the retail is, and there's a big, nice medical building there. We're going to move in June.
Okay.
And it gives us a bigger, nicer clinic. Thank you very much.
Okay.
Okay.
Come back. Because obviously this conversation must go much longer,
Yeah,
so you're going to
yeah.
have to come back.
Yeah, I'm happy to.
Good.
Anytime.
Thank you very much,
All right.
Doctor.
My pleasure.